Hi everybody. So today we're going to be talking about herpes. Basically, first of all, let me introduce myself. My name is Dr. Darlington Amadi. I'm a medical officer for Initiative for Equal Rights, TS. We want to know how well you know your sexual reproductive health, and today the topic is going to be herpes. What do you know about herpes? First, herpes is a virus. It has two stages. One is herpes simplex 1 and herpes simplex 2. Herpes simplex 1 basically is just when you have the oral herpes, but herpes simplex 2 is when it's sexually transmitted, where you have the symptoms around the genital regions and so on. So what are the causes of herpes? How can one actually get herpes? You can only get herpes when you come in contact with someone that is already infected, maybe via kissing or any other sexual reproductive or sexual activity. Then you can get herpes. So because like I said, herpes 1 is oral. It's when you have herpes around your mouth, on your oral parts of your body. While herpes 2 is when you have herpes in your genitalia, that's around your sexual regions, which is why it is transmitted when you have sexual contact or body contact with somebody that's already infected. Now, how can we prevent yourself from getting infected with herpes? How do you prevent yourself? Make sure you use condoms all the time, and of course, which means safe sex. Every time you're going to be having sex, it has to be safe. And also avoid body contact with persons that are already infected, especially when you know there is a herpes outbreak. Maybe somebody around you has short signs of herpes. You just avoid, or you yourself, you're already infected with herpes, just avoid contact with other people. There are notions that even when you share utensils and other stuffs with somebody that is already infected, but of course that's still in research. We can't actually say that when you share utensils with somebody that is already infected with herpes, then you have. But we're sure at certain that body contact or physical contact or personal contact with persons that are already infected, and then also when you have sexual activities with persons that are infected. Like I said, you can prevent it from always using protection or safe sex whenever you do having sexual activities with anybody. And then also avoid contacts. When you're already infected, you just avoid physical contacts with people around you, surrounding. That will reduce the outbreak, because herpes has been widely known to go from person to person, even when you're not showing any sign or symptoms of herpes. It can easily move person to person. Just where contacting or coming in contact with persons that are already infected, it can be transmitted. Then now, treatment. Herpes can be treated, but unfortunately there's no cure for herpes at the moment. But it can be treated and managed. So there are antiviral medications that will be prescribed over a certain period of time. Patients or the persons that are infected will take and help them manage and reduce the outbreak of herpes and the symptoms that it present. That's how herpes can be treated and managed. But there is no cure for herpes at the moment. We know how it is when people get infected with one sexually transmitted infection or the other. There are lots of discriminations and all. So we also need to support people that are affected emotionally and psychologically, letting them know that it's not an issue. It's a manageable illness or condition that one can manage and get it treated completely. But we're hoping in the future a permanent cure of herpes will come up, because researchers are going on talking about it, and they're making more research to find a permanent cure for herpes. So if you need more information or you need to ask any question, you can get us TS in every of our social media platform, and we have also consultation line that you can reach out, ask questions, and you can also walk into our facility anytime, any day. We have our days of opening on our social media platforms. You can walk in and speak to the doctor, whatever is it. And if you suspect you have herpes, you need to speak with your doctor. We can come into the facility as well to do that. Thank you.